Good morning to everyone. I'm Paulo Baldomir, and I'm going to present what we have done in FAGAL, the Alzheimer Federation of Galicia, during the COVID time. What I can say is that it was and still is a tough time for everybody, and that we all have learned a lot of new things in this period. Like almost everywhere in Spain, March 14th, 2020, care centers for people with neurodegenerative dementia were forced to close to minimize the impact of the coronavirus. To adapt to the health restrictions, all the therapeutic stimulation services were transferred to the users' homes. To do it properly, the interdisciplinary team was trained in health protocols to later bring to the users' homes the activities that had been carried out prior to the quarantine in order to maintain those residual capacities. According to needs, various professionals went weekly to each home to perform person-centered cognitive and functional stimulation therapies adapted to the needs of each user. Services were also provided to caregivers, such as training, psychological support, and mutual help groups. Both people with dementia and caregivers were provided with the necessary means to complement their required attention: phone calls, video calls, and cognitive stimulation applications. The objectives: keep on working and bring the cognitive and functional stimulation services close due to the COVID to the users' homes, maintain or slow the progression of the disease, offer a break time for the caregivers, and facilitate the communication channels between professional, family members, and people with dementia. The method, as I said before, goes from training of the interdisciplinary team in specialized health protocols in COVID-19, provide personal protective equipment, being in touch with people with dementia and their confined family members, to preparation of an individualized care plan, and expansion of means of communication with people with dementia and caregivers. About the results, all of them are important, but to highlight some, maybe I would say that the whole 15 associations that form FAGAL were involved. The cognitive stimulation at home activity with 1,630 users, and the activation at home and psychological support. The results on users: higher cognitive abilities and residual functional abilities prior to confinement were maintained, and caregivers saw reduced psychological and behavioral symptoms associated with neurodegenerative dementias. To finish, a few conclusions about what we have learned this time. Creation of new models of care and attention, the use of new intervention tools, which I think that came to stay, the adaptation of services to the needs of each user, and a proposal for a home stimulation model as a measure to prevent dependency for people with dementia to the Galician government. Thank you very much.